have a really interesting, dynamic conversation
with people who know what they're talking about.
I'm really excited to be here as both a physician who actively sees patients every day and also runs clinics with tons of clinicians who see thousands of patients a week.
We'll make it a little spicy. AI is not ready for clinical care.
How does next generation technology actually get translated?
So this is where AI to me is going to be really, really pulled to use in many of these situations.
Most leverage exists is in AI and next-gen technologies being co-pilots for the clinician.
So I agree with the co-pilot idea,
but I don't think we're ready.
And I can guarantee you 95% of my peers who have gotten ambient scribes for their practices in the last 12 months have no idea what I just said.
That should be totally available on their website. If it isn't, that's a problem.
We have to help folks in healthcare to be better at consumers.
I want AI to make better patients, not just patients better.
where do we not have any automation or any support?
Especially in the mental health field, like
Clinicians have been part of it. It's been rough.
I think in that way, AI can be incredibly helpful to train people and to support them because we are overburdened.
And we have an audience that has a lot of experience.
I'm curious for Max for doing and for anybody else who was involved in the wave of EHR adoption and implementation. How similar or dissimilar do you find the clinical receptiveness to AI?
Implementation is high touch.
Groups are just like really slow to adopt. We need to meet them where they are.
We want to be responsible. What advice do you have for how to do that?
I think Fridsma, like the company that I work with, like why not inject yourself and help create more safety and science in these tools because they're already being used by people. Check the answers that the agent wants to give out or the LM wants to give out before think aloud. And so it's a check validation. So we put little things like that on tools that people are using.
How do you foresee AI closing the healthcare equity gap that currently exists?
I think technology giving clinicians leverage to see more patients or deliver more care fundamentally changes the equation of access.
But what we do know is that most of that data is also incredibly biased. Like we know that bias exists in medical care and in mental health.
Dr. Shipram, a gastrosurgeon. And we're in the process of coming up with a completely AI-enabled healthcare system.
Thank you all for this. It's been very helpful. The question I have is, who's going to pay for it?
And I think it comes down to who will pay for this responsible AI. Well,
So, good news and bad news. Insurance companies are moving to more higher paid deductibles, which means patients have more responsibility. I tend to think that the places for opportunities are going to be in alternative payment models.
It's a really hard sell to make, and you have to find the champion at the group who can underwrite that.
Some in product management, I'm building revenue cycle management for medical.
I want to talk about data and the value of data.
that's very different than having clinically validating data. Even if it's synthetic, but it's developed by clinicians, right, that understand like edge case. Sometimes I want to quit. It's like, what are y'all talking about? There's no time for a clinical trial. Stop. You know, like that's so not the space that we're in.
Right now it's a buzzword. Everybody's, you know, if you don't have AI, you're like not buzzword compliant. And you have to make sure you have that in there.
We've had a lot of different topics covered, and I think we could go on for another hour easily.
What you're optimistic
about AI?
What I'm optimistic about is there are more and more healthcare professionals who are interested in AI.
And if I were to be optimistic about the future I want to live in, it's that this technology will empower patients to be able to be kind of not just the thing upon which we do medicine, but actually at the decision-making table, having conversations about what needs to happen.
It's like standing at the biggest library in the world with all the knowledge over time at your fingertips. We focus so much on like health challenges, but I do think that there's so much that we can do in terms of joy and thriving with these kinds of tools, and that makes me really excited for the future.
Thank you all.